As a junior doctor, this is how I know my patient is going to crash.
We can divide it into 4 sects. The first and foremost vitals we need to check is the respiratory rate. It is said to be the earliest vitals that changes before a patient becomes unstable. If the respiratory rate is above 30 breaths per minute, this is a sure sign that the patient might be going into an unstable state. The one is the increased work of breathing. So what do I mean by work of breathing? If you can see nasal flaring, or if the patient is unable to say at least one sentence in one full breath, that means the work of breathing has increased. Under the cardiovascular system, if there is a falling trend of systolic blood pressure, or there is a falling trend of mean arterial pressure, this usually means the patient might become unstable. And remember people, the foremost important thing here is we need to check the trends. Usually a single reading is not enough. If the pulse pressure becomes narrow, that is also a critical sign. The normal pulse pressure is from 30 to 50 millimeter mercury. And new onset tachycardia. If the patient becomes suddenly confused or drowsy or even really agitated, along with other vital signs, this is usually an important finding. So this is the most underrated advice I have seen, and this I can swear to death that if a nurse or an attendant comes to tell you that the patient is not acting themselves, please, for the love of God, go to the patient and check his vitals.